Hello, I'm Mason Tucrow, and I'm joined with Dr. Ashton Claiborne, the Chief Medical Information Officer at the Choctaw Nation Health Services Authority, and our proposed quality improvement project today is the Nabla AI Streamlining Documentation in Tribal Primary Care, set to begin in August 2025. Let's dive into how we aim to reduce documentation burden for our providers. At Choctaw Nation, our primary care providers face significant administrative burden from EHR documentation, contributing to burnout and after-hours work. Baseline 2024 Epic Signal data shows providers spend 136 minutes daily on documentation, with 23 minutes outside scheduled hours, known as pajama time, and 30 minutes on unscheduled days. A 2024 study found 40% of our providers report moderate to high burnout, with documentation as a key driver. This project aligns with our tribal healthcare goal to enhance provider well-being and retention by leveraging Nabla's ambient AI assistant, which automates note summarization through passive listening. Our aim is clear. By 2025, in December, we will reduce documentation time by 20% from 136 to 109 minutes daily, and provider work time outside work scheduled hours by 15% from 23 to 19.5 minutes. For 50 primary care providers at Choctaw Nation, we'll achieve this through the implementation of NAMBLA's ambient AI assistant, ensuring a culturally sensitive and streamlined approach to improve efficiency in our tribal healthcare system. Starting in August 2025, we'll use the IHI's Planned, Do, Study, Act methodology to implement NABLA over a 60-day pilot from October to November 2025. In August, we'll conduct a workflow analysis with 10 providers to map Epic documentation processes and configure Nabla's integration, ensuring HIPAA compliance. In September, we'll deliver 2 training sessions, virtual and on-site, for all 50 providers. The pilot launches on October 1st, with Nabla generating automated notes during patient encounters. We'll run 2 PDSA cycles, the first in October to monitor usage and adjust workflows, and the second in November to test refinements with 25 providers. Data collection will use Epic Signal dashboards for time metrics and surveys for provider feedback. Here are our projected results, visualized in Figure 1. We expect a 20% reduction in documentation time from 136 to 109 minutes daily, meeting our goal. Pajama time should decrease by 15% from 23 to 19.5 minutes, also achieving our target. As a secondary metric, time on unscheduled days is projected to drop 15% from 30 to 25.5 minutes. Qualitatively, we anticipate 80% of providers will report improved efficiency, though they may request training for complex cases like chronic disease documentation. These projections, based on 2024 Epic Signal baselines and literature, suggest Nabla will significantly reduce provider burden by December 2025. Our projected 20% reduction in documentation time and 15% in pajama time could alleviate burnout, aligning with Choctaw Nation's goals for provider retention and care quality. A key lesson we expect is that real-time Nabla support during patient encounters will reduce after-hours workload for tribal providers. However, limitations include potential provider resistance to AI and challenges with complex cases like multilingual patients. Next steps include conducting further PDSA cycles in 2026 to optimize Nabla, expanding to other specialties such as pediatrics, endocrinology, and cardiology, then presenting findings at tribal healthcare symposiums to advocate for broader AI adoption in Indigenous healthcare systems. This project will enhance quality and patient safety by reducing documentation burden, allowing more time for patient care. NABLA is expected to reduce documentation errors by 10%, improving Epic data quality, with HIPAA compliance ensuring data security. By decreasing pajama time, we'll mitigate burnout, fostering safer, more focused care for our tribal patients, especially in chronic disease management. Thank you for your attention. We believe NABLA AI will transform documentation practices at Choctaw Nation, improving provider well-being and patient care. For questions, please contact us at mwtucrow@cnhsa.com. We look forward to implementing this project starting August 2025. Thank you.